Show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home healthcare agency servicing Palm Beach County, Miami, and Broward. And you can reach us directly, 954-717-7027. I am your host, Louise Gomez, and I would love to welcome everybody to introduce Dr. Carlos Santos. He is actually so many different titles and degrees. He's a pulmonologist, internal medicine, sleep medicine, and actually so much more. He has two locations. The main office is 909 North Miami Beach Boulevard, Suite 402, and that's right here in North Miami Beach, 33162. And then the Sleep Diagnostic Center is at 3164 South University Drive, Miramar, Florida, 33025. And please look at his website, www.carlossantosmdpa.com. Thank you for joining us on the show today, Dr. Santos.
Thank you for the invitation.
Absolutely. You know, I'm looking at your bio, and I'm like, you have so many different degrees and specializations, and you do so much. I would love to find out a little bit more background. I'm curious to know what made you want to become a doctor.
Well, when I was a kid, 4 years old,
Okay.
my family gave me a doctor equipment, a toy.
Oh.
And since then, I said, I like to be a doctor. Then when I grow, I always grow in the church, and I like to help people. And in that manner, I developed the love for the profession that I finally realized.
So it works, having kids, planting those seeds, and, and working with your kids actually works.
Yeah,
Because
definitely that helped me a lot, and my family always support me.
I love that. So you went to the University of Puerto Rico, School of Medicine, right? And you've been practicing now for 27 years, is that right?
Not 35 years.
35,
I have been 35 years in practice.
Wow. Okay. So when did you decide that you were going to move from Puerto Rico, and what made you decide, take the leap and come to the United States and come to Florida?
I decided that in the year 2001
Okay.
because I have a child that had autism, and the treatment in Puerto Rico was not very effective, and I decided to move to U.S. to give a better treatment to him, and that worked out very well.
I'm happy to hear that. And at the same point, we get to benefit because now you're here with all these different services you provide. I know there's so much going on. There's a lot of new, I know we were briefly discussing the new technology as far as the sleep, in the sleep center, what you're doing, the Sleep Diagnostic Center. I know you were mentioning that there's some new technology and there's some new options for people who have sleep apnea, right?
Yes, there is a lot of new options. And between them, we have the Inspire device that is a tongue pacemaker that we put in the shoulder below the pectoral muscle. We pass a cable until the tongue, and that made the tongue reduce in size during the night, and in that manner, we don't need machines anymore.
So it's a small device you put into the shoulder.
Yes.
And then you said it's a cable that goes
to the tongue
to the
nerve.
tongue, and then that stimulates.
Stimulate the tongue, and that reducing size and let the airway be open.
So that's interesting. It's you're able to have this new technology that's able to detect when it has to open the airways, and it works, I guess, with your physiology.
Yes, definitely. It's a device very innovative. Was developed by the government. Government was the one that funding the research about this. It's a very interesting device. I've been working with that for several years now.
So it can anybody use this device, or you have to be a certain type of
You
sleep
have to.
apnea?
There is certain criteria for use the
Okay.
device. The first one is that the person did not tolerate the CPAP.
Okay.
That is first requirement. Second requirement is that the BMI of the person cannot be more than 40 to be considered for the
Okay.
device. Cannot be too obese.
Okay.
And also had to pass a test. The name is a DICE test. It's a direct laryngoscopy under sleep. And they will look to the larynx, and if the tongue fall back when the patient fall asleep, then he qualified for the device. 95% qualified.
Okay.
For the one that had this test. O sea que basically that are the three biggest criteria for consider for implant the device.
That's great, because there are probably some people that they don't want to do, like you said, they can't tolerate the
mask.
CPAP, the mask.
30 to 40% of the patient did not tolerate the mask.
Interesting.
That is the statistic for in all the studies, and we have not been able to improve this statistic with anything.
Right. I have a question for you, Dr. Santos. I heard or I read somewhere people who suffer from sleep apnea maybe tend to gain weight more. Is this accurate, or?
Yes, it's accurate. There is several hormones that are affected by the sleep apnea. The leptin, the ghrelin, that hormone are secreted in the stomach. And made the people have the desire for junk food, and also have the more appetite, and also the lack of sleep cause insulin resistance. So the people finish developing diabetes if we don't take care of this.
Yeah, so there are people out there listening, and they're probably wondering, maybe I should go see you. I'm waking up in the middle of the night, or maybe my wife says I'm snoring a lot, or my husband says I'm snoring a lot, right? So what would it look like? So they would make an appointment. They'd call and make an appointment. Now, do they have to go into the studio, or is there anything new that maybe they can do?
No, basically now the popularity of the home sleep study has grown.
Home sleep study.
We can do the
Nice.
study at home using a monitor. There is different kinds. Some are going in the finger, some are in the wrist. The one that I personally use is the one that has a sensor in the finger, a monitor in the nose for the airflow, and a band in the thorax. It's a very, very good device. It's very well proof and FDA approved. But there is many, many devices, about 15 in the market.
Okay, because sometimes people may think, I don't know if I'm going to be comfortable sleeping somewhere else where I'm, in a sleep lab. I won't get the same sleep quality. So I think just people knowing that they can do this at home would want to do it more, knowing that they have the opportunity to do it at home, right?
Yes, always it's good that you can do at home, but there is several situations that the study should not be do at home.
Okay.
Because the results are not reliable.
Okay.
The study will not do the maximum for us to help the patient.
Okay.
And that situation is when the patient has a cardiac arrhythmia or cardiac failure. If the patient has severe respiratory disease, should not be doing home. Patient that has seizures should not be doing home.
Okay.
Patient with BMI more than 50.
Okay.
Including the equipment doesn't fit on them in many times. People that doesn't have the ability to use the device.
I see. So maybe the best thing is that they call. I'm going to give your number. And this way they can call and make an appointment and see what would be the best option for
definitely.
them. Yeah, so it's the 305 653-0425. I think it's best that they call, and then you would decide, what would be the best option for them, right?
Yeah, always when you have a question about sleep, it's better that you go to the PCP or to a specialist on this, and they will decide what is the best that fit for you.
Okay. And I know that you do so much more than the sleep studies. What else are you doing that you're excited to share? Because I know you always go into conventions and you're always going
Yeah,
to
there is many new
yourself.
advancement in sleep medicine. We had the Inspire, that is one of the biggest ones that I was talking a moment about that. Also, there is a bongo therapy. Bongo therapy is a device that you put in your nose, and it's very small. It's only you put in your nostrils,
Okay.
and basically let the air go in,
Okay.
but doesn't let the air go out so easy. In that manner, increase the pressure in the hypopharynx, and in that control the sleep apnea. It's for a sleep apnea mild to moderate.
Okay.
Severe cases can use only Inspire or CPAP. Also, we have the Excite OSA. This is a new device.
Okay.
That is a device that gives electrical stimulation to the base of the tongue. And that device, we can use it in mild sleep apnea. After it's used for 3 months, 20 minutes a day, the patient, the sleep apnea can be cured. And he had to maintain using the device a couple of times a week, but they will not use machine.
So what I'm understanding is the good news about sleep apnea. It seems that people can improve over time when they continue with the devices, or they continue with the treatment that you recommend.
Yes, you improve, but the problem with the sleep apnea is that you never resolve the problem.
Okay.
It's a problem that will be with you for life. The only thing that can solve the problem, but only in a small quantity of patients, is a new surgery. There is a new surgery that is the airlift, and they tie the ioid bone that you have in the neck to the mandible, and they pull up, and in that manner they keep the airway open all the time.
Oh, okay.
But not everybody qualify, and
Sure.
the success is not so big. But yes, quantity of people is cured.
Okay, that's good to know, because I know last time you were here, I didn't hear about all these different.
No, all these different
right?
things are last 2 years, the development in last 2 years.
That's amazing.
And really have been big advances. However, we had to do a lot more in sleep apnea. It's I don't know, but maybe many people doesn't know, it's the most common disease in the world. More than 1,000 million of people worldwide have the disease.
Oh, wow.
And the disease have many causes, not only the weight,
Sure.
depending on the structure in the mandible. For example, Asiatic people had a short mandible, and that almost all of them have a sleep apnea.
Interesting.
In U.S., the major problem is obesity, but we have another problem in population in Western Europe with the mandible morphology, and all of that will cause the disease by different reasons.
We have a commercial break. We're going to be right back, and we'll continue this conversation.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hi, everybody. Thank you for tuning back in to You and Your Doctor. I have the pleasure of speaking with Dr. Carlos Santos, who is right here, local in South Florida. The phone number is the address is 909 North Miami Beach Boulevard, Suite 402, and the zip is 33162. And then the Sleep Diagnostic Center is on 3164 South University Drive, Miramar, Florida, 33025. You can certainly go onto the website, www.carlosantosmdpa.com. So, Dr. Santos, I am learning so much about sleep and sleep apnea, and I guess there's asthma and COPD, and there's just so many different types of people that I imagine come to see you for different types of treatment.
Basically in sleep apnea, as we discussed, we have a lot of new advancements that are now being known by the community. In asthma also, we have a lot of new advancements in the last years. We have the biggest advance that I have seen is the biologic medications. The biologic medication started in 2006 with omalizumab. Now we have about 7 different biologics. Basically, they work in different pathways of the asthma cascade. But patients that are on control from asthma, and they doesn't have to be sick all the time. They doesn't have to be visiting emergency room. They doesn't have to die from asthma. Really, this new family of new medication have been very helpful in the treatment of asthma. Many offices have available for being administered. Some places doesn't do it, but our place do it at least.
So, talk to me about adult onset asthma. I unfortunately lost somebody very near and dear to me who passed away, and he did not have asthma as a child, and as he got older into his 40s and 50s, he got adult onset asthma. Why does that happen that as an adult someone would get that?
That happened, it's very sad but basically that happened because there is different factors that can trigger asthma in a person. Mm-hmm. The most common is genetic, because they develop in the childhood. Usually in the adolescent, asthma disappears.
Okay.
Many of the child doesn't know that they have asthma when they was kids and doesn't associate that they have asthma in the adulthood. Mm-hmm. But adult patient can start also for exposure to toxic substances like chlorox. Some gases can cause asthma in a person that never have been asthmatic.
Wow.
The biggest problem that I have is the exposure to chlorox, because chlorox is a bit irritant on the airway. The problem is that you get the toxicity,
sure,
and you continue with the asthma.
Oh, wow.
It's not that you have a problem, we resolve the problem and disappear. No.
Oh, wow.
You can persist with the problem.
So some people have that reaction. They're cleaning with Clorox. They're not present. They don't realize they're breathing it. They're cleaning. So I just want everybody to know there's options. There's a lot of natural cleaning products out there, right?
Definitely.
There's options.
Absolutely. The thing is that other patients also develop asthma because of viral infection. A person that had the influenza can remain with asthma after that. People that had COVID, had RSV. All the viruses can cause
Okay, that's
asthma as a
Sure.
sequela of the disease.
That's right, because I heard a lot of like long haul COVID or post COVID
In many of them
conditions.
behave like asthmatic. Others have other problems, but many of them behave as asthmatic, and definitely we treat it like asthma.
So that's good that they can go see you and figure out, is it asthma? What is the difference between asthma and like COPD? What is COPD?
COPD is a disease that can be secondary to genetics too, but
Okay.
very, very uncommon that be because of genetic cause. The most problem with COPD is, in our days, is age.
Oh,
After 80 years,
really?
everybody have a little COPD. So you measure lung function, you ask in deep how the patient feel and what symptoms have. Everybody feels some short of breath. Everybody feel some coughing. And you measure the pulmonary function, and they have mild COPD in many cases. Other problem is the people that smoke.
Oh, yeah.
Smoking is a big cause of COPD.
Yeah.
It's decreasing because smoking has decreased. Vaping
I was
causes
gonna
pulmonary
say.
problem, but not at the degree that the cigarette.
I was going to say, a lot of young people are vaping, and when they're young,
Yes.
you know how it is. When you're in your 20s and your teens,
And it's not healthy.
no, they don't realize the
But
long
it's
term.
not so bad like the cigarette. The American College of Physicians do a statement
Okay.
that vaping definitely can cause pulmonary problem, but not at the degree of cigarettes.
Really interesting. Okay. Well, either or, if you're vaping, if you're smoking, put it down, right? Because
Definitely.
Yeah.
That will not help for your lung health. And in the long run, there is many problems associated. Vaping can cause asthma.
Okay.
Because some substances that are
Sure.
in the vaping can start to cause inflammation in the lung and develop asthma.
Yeah, because I imagine there are chemicals in the vaping,
Yes.
right? A lot of those vapes have chemicals. So, Dr. Santos, what can someone do to keep healthy lungs? Deep breathing exercises, walking. What do you suggest?
Okay. The most important thing is do exercise.
Okay.
The cardiopulmonary health is a lot better in people that exercise regularly than in people that not. There is not a special supplement for use to improve the lung health.
Okay.
There is several natural options that people have when they have asthma or allergies that they can try. But really, the lungs is doing exercise, don't expose to toxins or cigarette smoking or vaping. Be careful with a close place that has a lot of people smoking because that can affect the lungs too. And basically that there is not a magic solution
Sure.
to keep a lung healthy, but there is several things that you can do to prevent problems.
Absolutely. If anybody's listening and they have family that's still smoking or vaping, I would imagine you would encourage them to stop that.
Oh yes,
Yeah,
definitely.
Yeah. So, Dr. Santos, we actually have 3 minutes left. If you can believe this interview is already almost over. It's gone so quickly. In the last 2 or 3 minutes, is there any takeaways or anything maybe you want to share, or any great stories you want to share maybe that you have had a patient that has had a tremendous recovery or good experience?
Bueno, I have many experiences, but I will share a couple of ones. I was one of the first person that used biologic medication in asthma. I have a patient that the year before this medication appeared in the market, the person was between 6 to 8 months in the hospital intermittently. Entered the hospital, left the hospital, entered the hospital, left the hospital, and was very sick all the time, very sick. And I remember that when the medication was approved by FDA, I called to Atlanta, and was the Genentech company. And I called them, and they sent me a person to apply to see how the insurance covered the medication. This patient spent so much money in healthcare that the medication was approved in 24 hours.
Wow.
And the medication at that time was about $3,000 a month. Now, I don't know if it's cheaper or a little more expensive. But the patient, in 14 years, didn't come back to the hospital.
That is amazing.
And that person spent about $4 million in healthcare. $36,000 saved a lot of money.
Absolutely. I want to thank you for coming on to the show. I want to give your phone number and your information before we leave. So anybody who's
Perfecto.
listening, they can please get in touch with Dr. Carlos Santos. Number is 305-653-0425. And he's right here in Miami. So please give him a call and have a great evening, everybody. Take care. Thank you.
Good evening, and thank you for the invitation.
Absolutely.